Understanding and recognizing the early warning signs of a stroke is crucial for timely medical intervention, which can significantly reduce brain damage and improve recovery outcomes. Strokes can manifest through various symptoms, which often occur suddenly and without warning. In this video, we will provide a more detailed examination of these early warning signs. Just a quick reminder, we are not medical doctors. This video is for informational purposes only. Number 1. Sudden numbness or weakness. This symptom often affects one side of the body, such as the face, arm, or leg. The numbness or weakness can be severe and is usually unilateral, one-sided. The brain controls motor functions and sensations on the opposite side of the body. If a stroke occurs in the right hemisphere of the brain, it will typically cause symptoms on the left side of the body and vice versa. The indicators include the inability to lift one arm fully. Drooping on one side of the face is often noticeable when trying to smile. Weakness or numbness in one leg, causing difficulty walking or a sudden fall. Number 2. Confusion and trouble speaking or understanding. A stroke can impair the brain's ability to process language, leading to aphasia, difficulty in speaking or understanding speech. This typically results from damage to the brain's language centers, such as Broca's area involved in speech production or Wernicke's area involved in understanding language. The indicators include slurred or garbled speech, difficulty finding the right words or forming sentences, inability to comprehend spoken or written language. Number 3. Vision problems. Sudden trouble seeing in one or both eyes can be a symptom of a stroke. This may include partial or complete loss of vision, blurred vision, or double vision. The occipital lobe, located at the back of the brain, is responsible for processing visual information. A stroke in this area can disrupt vision. The indicators include sudden blindness in one eye, monocular vision loss, blurred vision or double vision, loss of visual fields, where parts of the vision in both eyes are missing. Number 4. Dizziness and loss of balance or coordination. Sudden dizziness, trouble walking, loss of balance, or lack of coordination are common stroke symptoms, particularly in cases affecting the cerebellum or brainstem. The cerebellum, located at the base of the brain, coordinates muscle movements and maintains balance. The brainstem controls many vital functions and connects the brain to the spinal cord. The indicators include unsteady gait or inability to walk without assistance, vertigo or spinning sensation, loss of coordination in limbs, leading to clumsiness or dropping objects. If you're finding this information helpful, please hit the like button, subscribe, and turn all notifications on to stay updated with our latest health and nutrition tips. Number 5. Severe headache. A sudden, severe headache that is different from any previous headaches, often described as the worst headache of one's life. This symptom is more common with hemorrhagic strokes, where bleeding in the brain increases pressure and causes pain. The indicators include intense headache with a rapid onset, accompanied by nausea, vomiting, or altered consciousness. May occur with other neurological symptoms, such as neck stiffness or light sensitivity. Number 6. Sudden onset of fatigue or general weakness. Feeling unusually tired or weak without a clear reason can be a precursor to a stroke. Disruption of blood flow to the brain affects overall energy levels and muscle function. The indicators include sudden, extreme fatigue, generalized weakness, making it difficult to perform everyday tasks. Number 7. Hiccups. Persistent hiccups can be an unusual sign of a stroke, particularly in women. Strokes affecting the medulla, which controls autonomic functions, can cause persistent hiccups. The indicators include continuous hiccups that do not resolve with usual remedies, accompanied by other stroke symptoms like dizziness or headache. Number 8. Shortness of breath. Difficulty breathing or shortness of breath can accompany a stroke, especially in women. Strokes affecting the brainstem can disrupt the autonomic control of breathing. The indicators include sudden onset of breathlessness, chest discomfort or palpitations, Number 9. Seizures. Although rare, seizures can occur as an early sign of a stroke. Abnormal electrical activity in the brain, triggered by disrupted blood flow, can lead to seizures. The indicators include convulsions or uncontrollable shaking, loss of consciousness or altered mental state. Number 10. Sudden behavioral changes. Unexplained changes in behavior, personality, or mood can be indicative of a stroke. Strokes affecting the frontal lobe or other areas involved in emotion and behavior can lead to sudden changes. The indicators include sudden irritability, confusion, or agitation, uncharacteristic mood swings or depression. Recognizing stroke symptoms and acting quickly is crucial. Brain cells begin to die within minutes of a stroke, and timely treatment can prevent further damage and improve recovery outcomes. The phrase "time is brain" underscores the urgency of seeking immediate medical attention. The FAST campaign. Face, Arms, Speech. Time is designed to educate the public about recognizing stroke symptoms and the importance of rapid response. Knowing these signs can make a significant difference in the prognosis of a stroke patient. If you or someone else exhibits any of the above symptoms, take the following steps immediately. Call emergency services. Do not attempt to drive to the hospital. Emergency medical responders can begin treatment en route and ensure the patient gets to the appropriate facility quickly. Record the time when the symptoms first appeared. This information is crucial for determining treatment options, such as the administration of clot-dissolving drugs. Stay calm and provide support. Keep the person comfortable and stay with them until help arrives. Provide reassurance and avoid giving them anything to eat or drink, as swallowing may be impaired. Understanding and recognizing the early warning signs of a stroke can save lives and improve outcomes. While the symptoms can vary, they often appear suddenly and without warning. Being aware of these signs, especially the subtle ones, and acting swiftly can make a significant difference in stroke management and recovery. Educating yourself and others about these early warning signs is a crucial step in combating the devastating effects of strokes. Keep in mind that we are not medical doctors, and this information should not be considered medical advice. This video is for informational purposes only. It is always best to check with your doctor for medical advice and treatment. They will know more about your individual condition. Remember to check out our other videos on this channel. Thank you for tuning in. Until next time on Health Info Hub, stay informed, share your thoughts, and subscribe.